shorten my discussion with us this morning. Let me start by congratulating the Association of Community Pharmacists for the team he has assembled to pilot the affairs of the association. And I'm also pretty happy that the association is getting stronger as it enjoys continuity and cooperation from all and sundry. It's no longer news that this is the first ACPN meeting I'm attending as president of PSN. And I want to say that ACPN remains the foremost technical group of PSN. And I'm giving that association so much attention in matters that affects its well-being. The community pharmacists in our engagement point not just to the community, but indeed every Nigerian. Pharmacists are obviously the first point of call by our patients, and so as to be able to have assessment on whatever medical condition they have. Our training as pharmacists prepares us for this excellent role. And this is the reason why NAFDAC insists on regulatory caveat effort that if after 3 days, for example, you are not getting better, you might visit your physician. So you could actually attend to the needs of your patients within the first 72 hours and get good outcome. And that's why pharmacists, especially community pharmacists, you are the most trusted person in the society. Unfortunately, as custodian of drugs, we are not properly respected in Nigeria, and this has contributed in no small way to the dismal health outcomes that we have. At the National Secretariat, the matter of health insurance policy, pharmacy recognitions as primary health care center are beginning priority. And I don't need to go into depth because your chairman has enumerated that. Also, even the case of pharmacy consultancy data. We also have encouraged translational research and improved utilization of available production capacity within the country. My dear colleagues, we have deployed resources at short notices to lend our support towards ensuring that pharmaceutical services is being recognized by primary givers in the National Health Insurance Authority. Myself and your chairman visited the DG, and we had very useful discussions. And we actually even proposed to do some research on this behalf, as I said, so that we can onboard whatever we have for global best practices, so that pharmacists, community pharmacists, will actually get the prescriptions coming to their pharmacy and do the needful appropriately. We know that in most cases, consultation with physicians to produce a prescription, which should be taken to the pharmacy for filling. In Nigeria, we have different illegal premises occupying this space. However, the silver lining is that there will be sanitation for full implementation of the new drug distribution guideline. Grapevine sources reveal that the Kano Coordinated Wholesale Center is ready for occupation, while those of Lagos and Anambra will continue to be developed. The sanitation of drug distribution is a good way to get colleagues back on track and in business. We want to thank the social media, because one other news that we visited the National Primary Healthcare Development Agency, NAFDAC, NHIA, together with the leadership of ACPN. PSN is working fully with the executive on the matter of global listing in NAFDAC. The conversation has begun and will certainly lead positively to much desired output. The Drug Management Organization, DMO, of the NHIA concerned have been brought to our attention, and a strategy to encourage pharmacists to take advantage of this and take a position that should the program become sustained. However, the area of concern of community pharmacists practitioners in DMO will be addressed, as pharmacists are the only registered professionals to dispense drugs in Nigeria. Pharmacists will be empowered to play their role in Nigerian healthcare system very soon, and some agencies of the Federal Ministry of Health are exploiting opportunities to help ensure this happens in a short while we cooperate with the Food and Drug Department of the Ministry. ACPN, I make bold say that it's a trace player and will be supported to continue. It is in the area of practice with most pharmacists, not just in the country, but you can also say that most of our colleagues who have gone outside the country have also blazed the trails and have also done exceedingly well in community practice outside the country. It's on this note I want to encourage ACPN members to participate in the upcoming F5P Congress in Spain. PSN is partnering with the travel agent to make the process seamless. On registration payments, in light of the current CBN cap on Naira cards for international payments, the Secretariat has gotten a waiver from F5P, enabling Nigerian delegates to make group payment via bank transfer. The PSN conference in Jos, let me quickly say, Plateau, is going to be enjoying the courtesy of our humble and noble General Gowon, retired as chairman. Nagri DG Dr. Odegwu will be the keynote address speaker. The FPL Chief Executive General Moma as a lead speaker in one of the panel discussions, among others. Several generations of PSN state chairmen have emerged over the years, and the state DPSs resulted in the current situation where the PIC is misjudged by those who are members of the committee. While members of PSN believe that PIC should be an enforcement team, PCN knows better. We have proposed to the leadership of PSN Registry on the need for a workshop to educate members of PIC, especially with the new PIC manual recently produced. The upcoming PSN Council meeting in just next month will present an ample opportunity for PSN Council, for PCN. We have the DPSs and state branch chairmen already in attendance. Only the PCN staff will have to join us to have a complete team for the workshop. More is expected from PCN, and we are working closely with them, and we can be assured that the registry will be up and running to create a conducive environment for the practice of pharmacy in Nigeria. We will need to support the registry in discharging our responsibilities effectively. As the Secretariat, be assured of our continuing effort to work closely for the good of pharmacy. Once again, I want to wish you a very successful conference and trust that you avail us with the community for prompt follow-up through. Thank you and God bless you. And lastly, I want us to also find time to pray with us. We heard from our chairman who has moved somewhere. It's a thing of joy for me as a teacher. He was my student in the University of Benin, and we've been working and partnering. And when with the National Secretary, Mrs. Belinda Falabi, we met in Abuja, and we sought to crystallize a bill on the headship of tertiary health institutions. And within 8 weeks, the bill is already coming up for public hearing. Yours truly will be there, and we are working with other groups to make sure that pharmacy gets the best and will be in the forefront. We are not interested in staying outside the boardroom. We will be in the boardroom and become decision makers. Thank you very much.
I am pharmacist Professor Cyril Usifoh, the President, Pharmaceutical Society of Nigeria.
So your advice to the Association of Community Pharmacists and your advice to them, sir?
ACPN is a technical arm of Pharmaceutical Society of Nigeria. They are actually the window that most people see because they are community-based and they reach the people more. And like the Health Act of 2014 clearly defined, they are primary healthcare center where they reach the community and where people can access health and medicine. There's a bill coming, a public hearing tomorrow. And let me not prejudice what will be discussed. But one thing we observed over the years, when UCH came on board, we didn't have the physicians heading them. We have people who were hospital administrators. And what practice also shows that people from different healthcare also head institutions. So we need people who are hospital administrators to be able to administer. It's not against any particular profession, but if a physiotherapist or a nurse can head, why not? We are not satisfied with what is going on with our health institutions. And you and I are living examples. Accessing healthcare is a problem, and we need to change the narrative. That's the essence. It's not a fight, it's what we can do to make healthcare accessible for the vulnerable and for the average person, so that we can get, we're talking about primary healthcare like you asked. These days, if you talk about curative, it's very expensive. So we need more primary healthcare opportunities and facilities to be able to advise the average Nigerian, the vulnerable. With the economic situation in the country, we need what we can do to help ourselves.
Success has been an opportunity for pharmacists to meet and discuss a few things that pertain to their livelihood one and how to push the profession forward. Very fortunately, you also discovered that there have been no rain, so it's been a good gathering, a good opportunity. But by and large, I think it's something that we are grateful to God about, and we're quite happy